Welcome to the One-Piece Implant Mentor podcast. I am your host and mentor, Dr. Andrea Joy Smith. For the past 16 years, I have placed well over 7,000 one-piece implants for denture stabilization and much, much more. The One-Piece Implant Mentor podcast introduces our audience to doctors who are successfully placing one-piece dental implants. My guest tonight is not only a close colleague, but she is also my niece. And all while she was in dental school, I often spoke to her about the way in which I practice dentistry, which is to set myself apart by offering new and innovative services that other offices typically do not offer. Procedures like Invisalign, which was pretty innovative back in 2005 when I began offering it. Other procedures like the pinhole surgical technique, lumineers, and of course the one-piece implant, which is still innovative because it is underused by our colleagues today. So naturally, when she graduated, I of course recommended that she set herself apart for the benefit of her patients and her practice. She followed my advice almost to the letter. Joining me on the podcast today is my niece, Dr. Melanie Marshall. Dr. Marshall, welcome to the podcast.
Thank you for having me.
So Dr. Marshall, I graduated dental school in 1994, and my complete educational cost for all 4 years was about $40,000. Fast forward to 2011, I'm sure that your dental school debt was likely in the low six-figure range, and today I think dental graduates are coming out of dental school in the mid to high six-figure range. What role did the cost of dental education play in your decision to start practicing dentistry directly out of dental school?
When I first graduated from dental school, I really did have a passion for public health and helping the underserved populations. And I did hold a few positions at public health dental clinics. It really did shape the compassion that I have for my patients. It helped me to hone in on listening to my patients' needs. But I quickly realized that that was not going to pay the bills. So I increased my skills and my knowledge in the business side of dentistry and decided that I would set out on my own and open up my own private practice.
Great. And when you made that decision to go into private practice, what was it like for you in the early years?
It was so scary, so stressful. It was really good having you as my mentor. I can't even think of how many times I had to call you or text you late night, early morning, asking some important question that I didn't know the answer to. But it really did help me gain that confidence in myself that I know what I'm doing the right thing for my patients by being a private business owner. So I was really grateful for pulling off the Band-Aid. I think I practiced public health for about 4 years. Okay. And then I opened up my office in North Hollywood at the end of that 4th year out of school.
I know you had me in your ear letting you know what I thought was going to be the best thing. Of course, I mentioned the one-piece implants, some type of orthodontic training, and other things like that. Of those educational journeys that I sent you on, what would you say was the most valuable in terms of adding to your practice value, adding to your patients' lives, and things of that nature?
Definitely the one-piece implant. It really did contribute a lot to my knowledge base, and it also helped to gain my patient base. It helped my patients feel comfortable and confident in what I could offer to them. When I would describe the procedure, the fact that we're going to have your tooth in place in about 3 months, maybe 4 months, and they're looking at me and they're waiting for the other shoe to drop. Like, what else? Because that's not what the other doctor down the street told me. I would be confident, and I'm telling them, no, I think I can do it in a different way in a shorter amount of time.
That is the reaction that we often get because a lot of our patients come from offices that have offered them conventional implants. Of course, conventional implants have their place. They play a very vital role in taking some of our patients from missing teeth and being edentulous for a lot of years into having teeth that they can eat and function with. But as everything that evolves, even with surgery, in terms of open heart surgery, a lot of things are done less invasively now. And this one-piece implant procedure is certainly in line with how I believe surgeries in general are going. When you made that decision to start placing the one-piece implants, what training did you do? And was it sufficient to gain that confidence and knowledge and skill base in order to start doing it for your patients right away?
Right out of the gate, I took an intro to One-Piece implant course, and it was a few hours, maybe 16 hours or something like that. And we did a demo. I was like, this seems okay. Seems like I should be able to do it. So I went ahead and made the investment. I had some initial capital to make some investments in some of the things that I knew I wanted to start doing for my patients. So I made that initial investment. I bought the implant kit. I bought my aseptical motor and handpiece.
Yes.
And I had maybe 20 implants or something like that to start out. And one of the first cases that I did, I think it was a single tooth, a lower incisor or something like that. And it went well, and you're doing your follow-ups, you're checking and just hoping that everything goes the way that they said it would go in the class.
Yeah.
And it did. That gave me that initial confidence that I needed. And truthfully, that intro course gave me a lot of confidence as well. But still, I did have to make some phone calls to you just to make sure I understood everything the right way. So I would say those initial things, getting the kit, going to that 16-hour course, and I was able to start after that.
Well, that's good. When I took my first One-Piece implant course, the doctor specifically said, you're going to be shaking in your boots when you do your first case. So go ahead, shake in your boots, put in that first implant, and everything is going to be okay. And he was absolutely correct about that. But I'm going to go back to something that you said about the initial startup investment. Dollar for dollar, startup costs, education costs, your implants and everything that you had to purchase. Would you say that it took you less than 1 or 2 cases to really gain that return on investment back in terms of productivity for doing the procedure?
Definitely. This was in 2011, so take that with a grain of salt. But I think I probably invested about $10,000. And after the first 3 or 4 cases, I think I was able to make back my initial investment. Now, keep in mind, I also am a PPO driven office, and so I did have some PPO write-offs. So that's why I say 3 to 4 cases before I made my return on investment.
Yeah, because often, depending on the size of the case, you can probably make it back in 1 or 2.
I've learned a lot over these past few years, and I'm actually moving away from accepting insurance reimbursement. So I probably could have made my return on investment after the first case had I not accepting those PPO fees. But we live and we learn,
Absolutely.
right?
Those PPO-based fees allow us to gain a patient base, some level of income. There's a whole lot of positive that can also be said about those cases, but it is very frustrating to have to continually write off large amounts. And I'm sure doctors all over the world, or all over this country at least, experience that as well. So now that you're up and running doing One-Piece implants, what type of impact do you think you're having on the lives of your patients? For instance, your denture patients, or your patients that have been missing 1 or 2 teeth for a while, or those patients who've been told that they're not candidates, or they are candidates but they can't afford it because of the expense of conventional implantology. Describe the impact that you've had on your patients' lives by offering this procedure.
I would say the impact has been all positive. I have this one patient in mind. She was a denture wearer. She was maybe on her 3rd set of dentures by the time she met me. She came in pretty frail, like a skinny, older looking woman, but maybe she was frail because she couldn't eat as well. I described what I was going to do for her, and I told her, the day we decide to do surgery, I'll place your implants. I'm going to retrofit your denture, because she had a pretty decent looking denture, and snap it in that day. And she's like, what else? And I'm like, you're going to go and live your life. You can come back to me for a checkup next week and next month and maybe in 2 months, but that's really it. She came in for that surgery, and she was so grateful. She cried on her way out. She called me the next week and said, Doctor, I can't make it to my appointment. I'm in Reno with my sister. I had a steak for the first time. She was a totally different person. I think I probably got her back into the office maybe a month after the surgery. And she looked completely different. Actually, I could see a little bit more life in her eyes and more strength in her body. That's really the kind of impact that we're making on our patients. It's such a simple procedure for us. is pretty straightforward. Place the implants, drill out the denture, retrofit it. But for them, it really is life-changing.
Those are the very patients that I think One-Piece implants were designed to help, but we are finding that we can help patients who are candidates for conventional implantology also, because I was speaking to Dr. Journo, the doctor who actually invented the implant that we use, and they developed a larger diameter one-piece implant supplied in 3.0 and 3.75 millimeters. And so even patients that have plenty of bone can receive a conventional size implant if it permits. But the beauty is that our procedure is so much more less invasive. It's a lot simpler. They can leave with a tooth or the denture retrofitted that day. And I bet that patient that you described, like you said, she hadn't had a steak in years, and I'm sure it changed her life.
Oh yeah, completely. Definitely.
I do know that you have taken courses in conventional implantology also. Can you tell me the difference that you feel with the simplicity of the one-piece protocol versus the protocol with the conventional implant? This is not to disparage the conventional implant at all, because it has certainly served its place in our profession, and it definitely has a place in our profession as well. But I want to give this audience, who are probably very familiar with the conventional implant technique, I want to give them a feel for how the less invasive nature, the faster healing nature of this procedure can be for their patients.
Oh yeah, I would say that placing a one-piece implant is much more straightforward than placing a conventional implant. Early on, I did the bulk of my training about one-piece implants. And then when I started focusing a little bit more on the conventional implants, I realized there were a lot more pieces involved. I'm needing to have the analog, I'm needing to have the transfer coping, and all of these things that with my one piece, I really don't need to have. For my one piece, I need to make sure I have the implant and that's really it. There was a bit of a learning curve for me when I did some extensive training with conventionals, because I had to say, can we take a step back? What's that part for? And what's this part for? I'm in the class and I'm putting it together. Oh, okay. You know, it took a little bit longer for me to make the connection. I think that it is much easier to place a one-piece implant, especially if you've been placing conventional implants for a long time. The transition will be a lot shorter.
You bring up a great point about all of the parts. You need your implant, your driver, and your pilot drill. That's pretty much all that you need. I'm in the process of restoring a full mouth case that was done at a larger implant house, all with conventional implants. Once I finally got the office to tell me all of the different parts, I had to proceed to dismantle this case. It's going well, but it has not been pretty, because when you have, for instance, a multi-unit abutment, it has the conical abutment on top, then it has the screw that retains the conical abutment inside the implant that's in the mouth, then it has another screw, the tiniest screw you've ever seen, to attach the appliance to the conical abutment. So while it's going to be a great case, a couple of the conventional implants that this patient had failed. And so I simply put in my one-piece implants to fill in the gaps. But once this case is all done, it's going to be beautiful and stable. I often hear people say, either you have all on 4 and a fixed appliance, or you have none on 3 and you have a denture. And so one of the things that this mini or one-piece implant does for us is it allows us to have the same type of appliance, be it a large full mouth reconstruction, fixed appliance versus the denture. If one implant doesn't integrate, you still have the same appliance and it works just fine. Have you been able to enjoy any of the benefits of that as well?
Yes, I have been. You make a good point about the fact that that particular patient, some of their conventional implants had failed. It's a fallacy to believe that one-piece implants don't do as well. They're not as permanent as conventional implants. And I have to really re-educate my patients as we're talking about the procedure. So yes, I have had the same thing happen to me, where I've had a patient with a conventional implant that failed, and then I'm replacing it or adding in some more one-piece implants. And then they remarked to me, wow, that was really different than the other time I had those implants placed. Are you sure the implants are in? And they almost question you a little bit, because they remember something that was way more involved than what our one piece is like.
They've gone through such an ordeal. The implant was inserted and left to integrate, which definitely has its merits. And then a few months later, they have the second surgery to uncover that implant. So they have gone through a different ordeal. And like I said before, those implants definitely have their place in our profession. They've done a great job in taking our patients from being edentulous to pretty much having teeth. So I have nothing but good things to say about it. But what I do like about our procedure is patients who are told that they're not candidates due to not having a lot of bone, or their medical conditions make them medically compromised to a point where they cannot sustain 2 or 3 surgeries if you add bone grafting and things like that. This is not only, though, a good alternative, it is actually a good first line defense against edentulism, whether you have any of those conditions or not.
Yeah,
would you agree?
I definitely agree.
So we've heard a little bit about your journey on how you got started in public health, and then you opened your private practice, and now you're actually journeying toward removing some of the PPO plans so that you can probably do more implant cases. What kind of blueprint now do you have in mind for yourself as you go forward to eliminate the PPO plans, to do more one-piece implants, marketing? What type of blueprint now do you envision for yourself to make this one-piece implant part of your practice even more successful?
Well, I am continuing to develop my blueprint and my thought process. The thing that has served me really well is that in the very beginning, I made sure that I strengthened my conversation skills. So I have those really strong connections and bonds with my patients. So as I embark on this journey of becoming out of network, I'm able to just lean on that. I can't tell you how many conversations I've been nervous to have because I've had a patient, let's say they've been with me for 5 years, and now I have to tell them, when you come in next time, I'm not going to be in network with your insurance. And they're like, oh, doctor, I don't care. I'm staying with you. I found a gold mine when I found you. In fact, you should have been charging me more from the beginning. That has really helped my confidence in having those conversations with my patients. And so for me, I'm going to continue to have those strong bonds with my patients, making sure that we have that really good connection. And being out of network will also allow me to really build my practice and pay down some of those student loans. You know, they're just out there hanging out in the background and I'm just making payments, but I do plan to help myself financially. So that will really help me as well.
That's very, very good. You bring up a good point about being able to get away from the PPOs. What I found is that you actually have more time to do implants. And if you market it properly, like I've taught you to do, and I know that you do it, those patients come in pre-sold, ready to go, and it's actually going to make your life a little bit easier. Yes, you'll probably lose a few of the patients, not all of them though, because I have a lot of patients that continue to stay with me regardless. You might lose some of those patients, but you're going to gain the ability to help more patients who are probably in a more dire dental situation than some of the patients that rely a lot on PPO fees. It's definitely going to be a win-win. What advice would you give a dentist who is hearing about one-piece implants for the very first time? They might have some preconceived notions about one-piece implants that may or may not be well-founded or grounded in reality, so to speak, because there is a lot of misinformation out there. What advice would you give this doctor who's never heard of it being so successful before in order to get them to be less hesitant about implementing this protocol in their office?
The first thing that I would tell a doctor new to placing one-piece implants is that if you can do an extraction, you can place a one-piece implant. Placing a one-piece implant might be easier than doing an extraction. That's the first piece of advice. And the other thing that I would recommend is that they start small. Start with a small case, something that was really laid out very clear in your course so that you can just focus your mind on that one thing. Start with a small case on a patient who you feel would be a really good candidate for it, and then go from there and do some of the more complex cases. But I think once you do that first case and you jump that first hurdle, you'll realize how smooth and how seamless the process can be with a one-piece implant.
That's excellent. When I learned this process, they talked about stabilizing the lower denture with 4 implants because the patient's already edentulous. There's already mature bone sites. You can plan that case very well. You can do a stent for that case, and it can go very well. And I agree with that. But I actually think the easiest case is to start with an edentulous area with one tooth, a bicuspid, a lower anterior, using even the Milo implant that's a little larger if you like, or the One-Piece implant, which are FDA approved to be used in the entire mouth for fixed or removable restorations. So that's a good point. One other point I want to bring up is less referrals out of your office. Patients feel more comfortable with you. When you were talking about building those bonds with the patients, the last thing they want is to have to go to another office to have a certain procedure done only to come back to you.
I couldn't agree more. I have so many patients and I'm looking at a particular case and sometimes I do need to refer them. But those other patients who have come to me after having had maybe an implant done somewhere else, they have their line of questioning already. Do you place the implant? Yes. Well, what about the crown? Do you restore the implant? Yes. I do that all here in my office. Okay, I'm sold. Because they don't want to be shuttled around from office to office. Each office has a different protocol. Each office may deal with their insurance benefits in a different way. And once they gain that trust with my staff and with me, and then when they hear me describe the procedure, they're like, okay, I'm all in. I'm going to do it. When can I sign up? When can I do it?
That is the exact response that I get. Doctors that are maybe hesitant to perform this procedure can benefit so much from what you have shared. I'm sure your journey is going to sound really familiar to a lot of different doctors. And so we encourage doctors who want to get started with this procedure to just take that leap of faith, do the first procedure, and just get started. Dr. Marshall, thank you so much for joining the podcast. And I look forward to talking to you again as you further your journey and have even more to share with our listeners.
Well, thank you so much. I really appreciate the opportunity to share what I've been through.
The one thing I want to touch on before we finish is that I did have the pleasure of having you work with me personally for a few months. Can you describe what having a mentor or somebody right there by your side, how valuable was that into giving you even more confidence to go and get started on this journey?
It was a really great thing to have you as a mentor. Some of the small questions that you have that you may not even have time to ask another colleague, if you have someone right there shoulder to shoulder with you, it helps to kind of calm some of those fears that you have. I learned a lot of different things from you. Sometimes I would be placing my implant and it torques out and I'm like, oh my gosh, what do I do? You're like, no, just reverse it out. Wait a few and then go back in. Or sometimes I would just take the whole implant out, prep a little bit more, and then it would go back in with no problem. So it was nice to be able to see you do some of those cases. And then I would say, oh my gosh, that happened to me too last week, but I didn't know what to do. And you're like, yeah, you just do this. So it's really nice to be able to have someone to bounce those ideas off of and someone who can help walk you through some of those areas that may feel a little bit uncertain or little gray areas to tweak the whole process.
Absolutely. I've been doing this procedure for so long, and so things that have become second nature for me are going to be new to others. And so that's one of the motivations for me becoming a One-Piece implant mentor, because I think that you can go pretty much anywhere and learn to do conventional implantology and follow that more complicated protocol. But the One-Piece implant protocol is a lot more simple. And if simple things like that happen, it's great to have someone to bounce it off of. So I appreciate you sharing that with our audience as well. Well, thank you so much. I'm sure that we'll see each other very soon. And I'm pretty sure we'll be able to practice again in some capacity in the very near future.
All right. Well, thank you.
You're welcome. Thank you for joining the One-Piece Implant Mentor podcast.